Welcome to Speech Therapy Unit Explains, the series where we talk about types of communication disorders for you, the public. Today, we will be explaining stuttering. Stuttering, as defined by the American Speech Language Hearing Association, or ASHA for short, is a fluency disorder that interrupts the flow of speaking. No one speaks smoothly 100% of the time. We occasionally add words such as in our speech. These interruptions are called disfluencies. These are normal in everyday speech. However, people who stutter typically have more disfluencies than usual and various types of them. The types of disfluencies include repetitions, prolongations, and blocks. Repetitions involve repeating parts of words or whole words. Repeating whole words is typical and are not seen as stuttering. However, repeating part of a word is considered stuttering. For example, I like to bake. Prolongations are what we call sounds that have been stretched out for a long time. An example of this is, I like to bake. Blocks are moments in speech where a person has a hard time getting a word out, leaving a long moment of silence. For example, I like to bake. Stuttering involves not only disfluencies, but may also include negative reactions to speaking, avoidance behaviors such as choosing not to talk on the phone because the person stutters more in those situations, escape behaviors such as head nodding or eye blinking in an attempt to stop the stutter, and physical tension. Stuttering often has emotional and psychological effects on people who stutter and can lead to negative thoughts and feelings about themselves or communication. While there is no one cause for stuttering, research suggests that family history is a possible cause. Many people who stutter will find that they have a relative who also stutters. It is still not always known which children will stutter and which will not. Still, there are known risk factors, including gender, as boys are more likely to stutter and continue stuttering than girls, when stuttering began. If a child starts to stutter after 3.5 years of age, the risk of continuing to stutter increases. If you believe your child stutters, it is recommended that you seek help from a speech-language pathologist sooner rather than later. It is best to seek professional help if you notice any of the following. Your child's stuttering has lasted for 6 to 12 months or more. Your child starts to stutter late, after 3.5 years old. Your child starts to stutter more often. Your child tenses up or struggles when talking. Your child avoids talking or says it is too hard to talk. Or there is family history of stuttering. Stay tuned for part 2 on this topic, where we will give recommendations on what can be done at home if you have a child that stutters. Thank you for watching this episode of Speech Therapy Unit Explains. All references used can be found in the description box below. If you found this to be helpful or informative, please like the video, click the subscribe button, and ring that notification bell to be informed of all future videos. Thank you again, and we hope to see you here next time.